Thomas, you've got an interesting story, I think, that backs up why you and your practice are now involved in sleep apnea. You encountered it personally with your son. Tell me a little bit about this story.
Yeah, so a couple of years ago, before COVID hit, I started getting those phone calls from the school that no parent ever wants to get. Your child's not performing up to his potential, he's being disruptive in school, he's not interacting appropriately with the other kids, and you're saying to yourself, that's not my kid. I know my kid. My kid is loving, he's sweet, he gets along with everybody. And then they say, you should have your child evaluated. And you know what's coming next. Your child has ADD, your child has ADHD. And then you know what's coming next after that. They want to put them on medications so that your child can perform up to their full potential.
Can I ask how old your son was when this event took place?
So my son's now 8.
Okay.
The phone calls started coming in at around age 6.
Wow.
And you want the best for them, so you follow the recommendations. But in the back of your head, something's not right. That's not your child. What they've told you and what's happening is a disconnect from the child and you love. But you don't know what to do. And of course, you don't want your child on pharmaceuticals.
Sure.
None of it's good. It's all bad, right?
Okay, so that was an occurrence. What then happened after that?
Gosh, about 4 months ago, Dr. Stock asked me to look at a video about airway in Vivos. And it was just like a light went off in my head. They described my child. They talked about how children with ADD and ADHD are behaviorally identical to kids who are sleep deprived. You put them in the room and you can't tell who's who. I went, that's my child.
Wow.
That is my child. And I'm just like, I went and talked to Dr. Stock afterwards. I'm like, we've got to do this for my son. We have to do this. We did the sleep test.
Okay.
Yeah, it was identified that he had mild sleep apnea. We digitally imaged him so we could actually see his bite in 3D. So after going through the parent instructional video and so forth, it meant a couple of things. One is that his jaw was not developing, so there was space for his tongue in his mouth. What does that mean? When he's sleeping, there's no space for your tongue, it's going backwards, and he's not breathing. And because he's not breathing and getting enough oxygen, he's not breathing through his nose, his mouth is gaping open, and he's having apnea sessions. He stops breathing at night, and he's a heavy breather. And we decided to move forward with treatment. And step 1 of treatment was a trainer, okay? And
a trainer?
A trainer, yeah. So before you actually go into the sleep appliance, they want you to get used to it so your child's sleeping through the night. So I told my son, so I've done Invisalign, I'm doing Invisalign. Prior to that, for about a decade, I had a night guard. I said, so, you're going to get a night guard like Daddy. He totally knew what that was. And that, that's like big boy stuff. He's getting something like Daddy. So he was all on board, right? It looks like a sports guard or it slips in there and, it goes in the mouth, right?
I mean, I get this picture of like, your football mouthpiece with the,
Well, no, so this has got to be such that it's small enough, it's big enough to help move and get you trained to moving your teeth.
Okay.
But it's small enough so that you get your lips wrapped around it to get that seal you up.
Okay.
Right? Because you want them to be a nose breather, right? The first couple of nights would go in, he'd fall asleep, it'd pop out, right? And then I'd be like, oh, okay, go in and check him and so forth. By night 7, he was actually starting to seal his lips and hold it the whole night, the way he wanted to, right? So he adapted, in my opinion, very quickly. Day 9, he went back in the office and Dr. Stock and her team did another scan of him. And we were able to see the difference in the strike points of his teeth. I can't really explain it. There are pictures of it. I took pictures of it with my phone and so forth. But before treatment, there were all these spots that were red. All I can tell you is red's bad. After 9 days of treatment, the number of red spots where the teeth were hitting and so forth was reduced by half. And that's only 9 days with a trainer. Trainers usually about 3 months roughly, okay. And we're capping out at that point. And now he's getting ready for his first appliance.
Now that you're involved in dentistry and you are involved now in sleep apnea, what are you finding out? What are the facts? What are some of the things that you're hoping to achieve with your own son, which you're now seeing as documented with your sleep apnea devices that you're helping other patients with?
The cases and the before and after results, some things I'm very excited about. One of the benefits I'm hoping for, it's not a guarantee, but I'm hoping for, and I'm very optimistic about, is that maybe he'll be able to come off that medication. That would certainly be a personal win for him and for me. The big thing is if you're having apnea and you're not sleeping deeply at night, you're not storing information. If you're not storing information, you're not learning. I want my son to flourish. I want him to perform well. And I want him to be a superstar in school. Friends, teachers, relationships, academically, and in the upper stratosphere. I want nothing but the best for him. And all of that can't be achieved without quality sleep.
Sure. I mean, if you're half asleep or 3/4 awake, you're not at your best any place in life.
Sleep, airway, quality sleep is a chronic problem in this country. And the good news is it's solvable.
Tell me a little bit about other symptoms. So say I'm a parent.
Yeah.
Well, so obviously dark circles, these allergies.
Yeah. Adenoids, tonsils.
Yeah, so adenoids, tonsils. So what am I going to see as a parent?
So you take your child to the pediatrician, and the pediatrician's going to do their annual exam, right? They're going to look in the ears, the nose, and the throat, right? And they're going to be like, little Jimmy or little Sally's adenoids or tonsils are inflamed. We need to monitor that, or maybe they need to come out because they're impacting airway.
Gotcha.
Right? Gotcha. But why is that happening, right? It's because the mouth is open, the air's not being filtered, it's going down the throat, and it's inflaming it, which also causes problems with allergies. In addition to that, dried, cracked lips would be another indicator. Obviously, falling asleep and what have you is another prime example, right?
Right.
School performance, right? They're not performing up to their potential in school. Another one, which I find fascinating, and it's sort of the unspoken fact, is bedwetting. I'm not talking, 2 or 3 year olds, kind of learning to manage themselves. I'm talking about 8, 9, 10, 11, 12-year-olds wetting the bed. The child, while they're sleeping, they're having a sleep apnea event. They're asleep, they're not breathing. And the body's saying, wake up. Alarm bells are going off, but the child's not breathing. So what does the body do? It urinates as a way to stimulate them, to wake them up so they could go and get that breath of air. Wow. It's a survival tactic.
Wow.
There's a whole slew of things, obviously anxiety, depression, maybe paranoia. But there's a whole slew of things that all get triggered by airway, restorative sleep, deep sleep, quality sleep.
Sure. Well, you think about any of those things. I mean, even on us, how do you deal with life situations when you have, insufficient sleep? Well, you're easily more triggered for anxiety, stress, just general tension. Yeah. So, I mean, it makes sense. Everything you're saying just makes sense.
And if you're not getting enough sleep, how do you manage and regulate your own emotions? You don't have the capacity to, because you're struggling already, just moment to moment, being awake and so forth. If you don't have that restorative sleep at night, you don't have that, you're not waking up refreshed and have good control over all the elements of your body, including your emotions. Right. So how can you deal with the world around you and so forth and be master and commander of your own life if your life is controlling you?
Well, best of wishes and luck on this treatment. It sounds like you found some gold here in all your picking. So I'm very interested to hear the results.
We will have another discussion later on. I'm very excited about the results also.